New evidence suggests that the ancient Egyptians were skilled in performing cancer surgery, showcasing their extraordinary medical capabilities. Greetings everyone. Today's video focuses on a fascinating discovery that suggests ancient Egyptians may have been performing cancer surgery. We have uncovered two skulls, dating back thousands of years, that exhibit clear signs of cancer. Remarkably, one of the skulls even shows cut marks, indicating a surgical procedure was performed. These findings provide valuable insights into the ways in which ancient Egyptian medicine approached and potentially treated cancer. In addition to the cancer-related discoveries, the skulls also revealed evidence of healed traumatic injuries. This raises intriguing questions about the involvement of women in conflicts during ancient times. It is important to conduct further research to gain a deeper understanding of how ancient societies dealt with cancer and the roles women played in historical conflicts. Without any more delay, let us dive right into our discussion and explore these captivating findings from the ancient world. The ancient Egyptians displayed remarkable expertise in the field of medicine, as evidenced by historical texts. Their abilities extended to the identification, description, and treatment of various diseases and traumatic injuries, as well as the construction of prosthetics and dental fillings. While they were unable to treat certain conditions such as cancer, it is possible that they made attempts to do so. An international team of researchers has recently conducted a study on two ancient human skulls, exploring the boundaries of traumatological and oncological treatments in ancient Egypt, both of which date back thousands of years. Tatiana Tondini, a researcher at the University of Tübingen and the lead author of the study published in Frontiers in Medicine, pointed out that while ancient Egyptians demonstrated proficiency in treating intricate cranial fractures, they still faced significant challenges in understanding and addressing cancer. Prof. Edgar Camaros, a paleopathologist at the University of Santiago de Compostela and the lead author of the study, highlighted the significance of this discovery in shedding light on ancient Egyptian medicine's approach to cancer over 4,000 years ago. He described it as a unique piece of evidence that provides an extraordinary new perspective on the history of medicine. The researchers aim to gain insights into the prevalence of cancer in ancient times and how societies in the past dealt with this disease. To achieve this, they analysed two skulls from the Duckworth collection at the University of Cambridge. One skull, labelled as skull and mandible 236, belonged to a male individual aged 30 to 35 and dated back to 2687 to 2345 BCE. The other, skull E270, belonged to a female individual over 50 years old and dated back to 663, 343 BCE. Upon microscopic examination of skull 236, the researchers observed a large-sized lesion indicative of neoplasm, a condition characterized by extensive tissue destruction. Additionally, they identified approximately 30 small, round, metastasized lesions scattered across the skull. The researchers were taken aback by the finding of incisions encircling these abnormalities, most likely created using a precise tool like a metallic implement. "The sight of the cut marks through the microscope left us utterly astounded," exclaimed Tondini. According to Prof. Albert Isidro, a surgical oncologist specializing in Egyptology, it appears that the ancient Egyptians had some knowledge of surgical procedures for treating cancer. This suggests that ancient Egyptian medicine was not only capable of experimental treatments, but also engaged in medical explorations specifically related to cancer. A significant finding is the presence of a large lesion consistent with a cancerous tumor that caused bone destruction in skull E270. This discovery indicates that while modern factors such as lifestyle, aging, and environmental carcinogens contribute to the prevalence of cancer, it was also a common ailment in ancient times. Skull E270 exhibits evidence of two previously sustained traumatic injuries in the form of healed lesions. One of these lesions appears to have been caused by a close-range, forceful encounter involving a sharp object. The presence of these healed lesions suggests that the individual may have undergone some form of medical intervention, ultimately leading to their survival. It is rare to come across a wound of this nature on a female, as most injuries related to violence are typically observed on males. Tondini questioned whether this particular female was engaged in any form of warfare, which would necessitate a re-evaluation of women's roles in historical conflicts. However, the researchers acknowledged the difficulties inherent in studying skeletal remains, as they are often incomplete and lack any accompanying clinical records. Isidro emphasized the challenges faced by archaeologists, who must navigate a fragmented glimpse into the past, making it challenging to arrive at definitive conclusions. Camaros concluded that this study not only offers a new perspective, but also establishes a promising foundation for future research in the field of paleoncology. However, further studies will be necessary to unravel the methods employed by ancient societies in managing cancer. To support our channel's growth and ensure broader awareness, kindly hit the like and subscribe buttons. This will help us reach more individuals and disseminate valuable information. Thank you in advance.